My name is Scott Herbert. I'm a medical oncologist, and I'm currently the president of Nexus Health. Nexus Health is an independent, provider-owned, multi-specialty practice. Our desire in Santa Fe was to be the outpatient center of choice that contained all of outpatient medicine in one location with no siloization of medical field. The group was founded in late 2022 as a group of independent medical providers got together and decided to start a group practice. We're focused on outpatient medicine. We're focused very intently on urology. We came into a situation where there were two hospital systems, but not a lot of outpatient independent centers. And the key to that is that the cost of each of those facilities is markedly different for the exact same service. We wanted to offer an alternative employment arrangement for physicians. Hospitals have very standard employment models, and we wanted a partnership model where physicians or even mid-level providers, such as advanced practitioners, could become partners in their practice and have some degree of ownership and autonomy in their practice. From an outpatient medicine, physician-run practice, we believe we can direct care in a more efficient manner. Hospitals operate under what's called a hospital outpatient department model of billing. That means they charge a facility fee, and that means their negotiations with insurance companies are also predicated on access to their inpatient facilities. That means their contracts with Blue Cross Blue Shield, United, with commercial payers are typically 200% higher than contracts that independent outpatient doctors get for the exact same services. So when hospitals control a market, the cost of care skyrockets. Our competitive advantage is we're coming into a situation and we're going directly to payers, to the government, and to patients, saying we can offer you high quality services, the same breadth of services, and we can do it anywhere from 200 to 500% less cost. And that helps the patients because they're not faced with the same out-of-pocket for facility fees, co-insurance, and deductibles. In our current market, we have a lot of very basic blocking and tackling issues related to scaling. We have a scaling issue related to how do we take advantage of our setup with payers and with the government. So how do we focus on value-based care and obtain the correct contracts with payers so that we are managing populations correctly, we are hitting all of the quality measures we need to, and we are proving a savings that we can share in with payers. We're offering some very novel products to both Santa Fe and outside. We have a whole practice concierge model that we are trying to build. Concierge medicine is very new to the country, and it's becoming more popular. And what we're trying to do is give patients a concierge access point, a concierge primary physician, but then say that all of the specialists involved in Nexus, you now have immediate access to that specialty network also. Scaling that, getting people to understand the model, find value in it, and to package it in a way that works really well, I think that's another scaling issue. And so I think what I would ask students is, if they were going to evaluate each of our opportunities, how would they prioritize them? And where would they focus resources in a resource-limited world? I think that would be question number one. Question number two would be, I wonder if our strategy is applicable in other markets, and is there a possibility for expansion? The reason we have such an opportunity here is because the market was essentially controlled by one large hospital system that charged very high prices. Would our same strategy be applicable in other markets? When you refer outside of that primary care group to specialists, many times those specialists are housed in an expensive hospital network. So that spend, that medical spend, is now completely out of your hands. We've solved that problem. The primary care doctors are all together, they have the same mission, they have the same data, we have great tools, and we have a high quality, low cost specialty network that can take care of those patients. Accountable care organizations around the country have actually contacted us and said, how are you doing this? We need a high quality, low cost specialty network for our primary care doctors. How do we do it? A key piece of that also, though, is when we approach payers with value-based contracts, do they have the capability and the sophistication to engage in those conversations? That is a key part of our local scaling issue. Outside of that, on a more regional basis, we have a different set of scaling opportunities. Is there an opportunity for concierge practices around the country to send their patients to Santa Fe for a concierge retreat once or twice a year to focus on longevity and health span, whole body MRI, cancer screening, cardiac calcium scores, the types of things that you don't do frequently with your primary care provider, but once a year, as part of a total body health checkup, could you get that done in a place like Santa Fe? I think that's a really interesting, scalable opportunity. The other is our model of an integrated, outpatient, low-cost, high-value system. Is that strategic model applicable in other markets? Both the government and payers are absolutely pushing value-based care. Everyone understands that we cannot continue to pay close to 18% of our GDP, and that may be conservative, on healthcare. Well, the simplest and fastest way to lower that cost of care is make sure that care occurs in the appropriate setting. So you're not going to a hospital-based high-cost system for something that could be handled exactly the same way in a lower-cost outpatient setting.